There are three different types of shoulder instability. Most commonly is anterior shoulder instability. That's seen in our young athletes. My football players, my hockey players, my lacrosse players, that contact and collision, when they fall and their arm is out away from them, it can become dislocated, but in a forward direction. There are some people who have posterior instability, but that often is not a feeling of instability, more discomfort and pain because it's not sitting quite right. But there are some people who their collagen is generally loose, and so they have what we call multidirectional instability. So their shoulder becomes unstable, but in a circumferential way where it's just loose all around and doesn't really sit where it belongs. I try very hard to have most of the instabilities treated initially non-operatively, although we know statistically that if you are less than 20 and your shoulder has come out of place once, the likelihood of it happening again is almost 100%. Once you're past 20, the likelihood of it coming out again goes down. And so those for sure I have all go to physical therapy to work on range of motion and strengthening. So if they can prove to me in the office they have good protective range of motion and strength, they can return their sports. But if they are still limited in what they can do and they still have feelings of instability, they show up and they'll complain that it doesn't feel right, that they feel like it's coming out of place when they're rolling over in bed, reaching to put on their seatbelt, turning off a light, hanging up clothes. Those patients, if they're continuing to have those symptoms despite therapy, often need surgery. So somebody who has a shoulder reconstruction for their shoulder instability will be done as an outpatient. They'll be immobilized for 6 weeks, and they'll go to physical therapy that often takes between 4 to 6 months to complete. Once they're done and they have regained all of their motion and strength and can protect themselves, they can go back to playing their sport.